if you want to get pregnant, you're morbidly obese, you're thinking of IVF, consider weight loss surgery first. You may not need IVF, and if you do, the success rate of the pregnancy will be much higher. The infertility of young women who are obese. Why are they infertile? Because they have polycystic ovarian syndrome. For a woman to ovulate normally, to have her cycle be normal, and at some point release normal eggs that can get fertilized and she can get pregnant, it requires a certain level of hormones to go up, down, and cycle. Estrogen, progesterone, etc. When you're severely obese, that cycle gets messed up. Why? The fat tissue, the adipose tissue is making excess estrogen. Those high level of estrogens do not let your ovulatory cycle regulate correctly. So most most young women who are obese will tell you I have very regular menses, menstrual periods. Sometimes they don't come, sometimes they come super heavy, they're unpredictable. That is why, because the ovulatory cycle is messed up. And so they have high rates of infertility. So a lot of those women are going for IVF. Awesome. But unfortunately, when they do get pregnant with IVF, they're now a very high risk pregnancy because their BMIs are large, 30, 35, 40. Now they're pregnant. So yes, it's wonderful, but now it's a very high risk pregnancy. Eclampsia, preeclampsia, gestational diabetes, lots of complications, etc. So if you do weight loss surgery on that patient and you get rid of all the adipose tissue, they get back down to a close to normal BMI, their ovulatory cycles correct themselves, and all of a sudden they become fertile. The infertility goes away. IVF is not necessary in many patients. Plus, a pregnancy at a close to normal weight is going to be a much lower risk pregnancy. The other thing is, if they lose the weight and they still don't get ovulatory correctly, now you do IVF, but now the patient is a lower BMI, closer to normal, and the IVF is more successful, and the pregnancy, when it takes, is much lower risk. So, in the context of a young woman who's dealing with morbid obesity and infertility, bariatric surgery should play a central role to then, followed by IVF, to have a successful pregnancy.